Support for Radio Friends comes from La Brunerie Financial, where they work to ensure a lifetime of financial security for people from all walks of life, from investment services to retirement plans. If you're looking for a trustworthy company that has the experience and knowledge to put your interests first, contact La Brunerie Financial, a community-based investment counseling firm since 1966. Good morning and welcome to Radio Friends on this Monday, September the 27th. I have two of my friends with us, and they're both dentists, and they're nice people too. So if you got concerned about going to the dentist, you don't have to be. You know, that's one of the things that many people put off, making an appointment to go see their dentist because they're afraid of the pain. But nowadays, you don't have to be concerned with that at all. I want to introduce you to Dr. Philip Batson and Dr. Elizabeth Abe, Columbia Healthy Smiles, and they happen to be husband and wife dental team too. Good to have you both here today.
Thanks for having us.
Today, we thought we might talk about some of the items that you can buy over the counter for good dental health. And let's start, first of all, with toothpaste, because there's hundreds and hundreds of different varieties of toothpaste, and they're all screaming out at you that they are the best. How do you know what kind of toothpaste is right for your mouth?
That's a great question, Paul, and it is kind of can be an overwhelming aisle in the pharmacy department, or if you're at your grocery store or Walmart or Walgreens or wherever, to see all the different products and brands that there are, and toothpaste especially within some brands they have 6 or 7 different types of within the same brand, and a lot of it, what we always recommend is a toothpaste with fluoride in it.
Well, doesn't all toothpaste have fluoride in it?
Not all of it. Some of it is fluoride free, and so we do recommend a fluoridated toothpaste, and then any of them beyond that, most of the big ones, your Crests, your Colgates, the big ones are going to be pretty, and Sensodyne, Pronamel, those things, those are going to be good for you, good for your teeth, and do the job. We do always caution patients a little bit about seeking out the whitening toothpastes.
Why?
The reason for those are they're more abrasive. They have higher abrasivity, and so they can actually, because what they're trying to do is take away the extrinsic staining on the teeth, but it's more abrasive, and that's not healthy and good for your teeth, actually.
So if you're using the whitening, then you could be scraping off some of the enamel?
Yes, potentially, or if you have areas of what we call recession, or if you already have thin enamel, then that can cause more harm or sensitivity to those spots.
So if you have sensitivity, stay away from the whitening toothpaste.
Yes.
But I didn't realize that you need to check the label to make sure that it has fluoride, because all toothpaste does not have fluoride.
That is correct.
Okay, so check for the fluoride.
Yep.
That's anti-cavity, right?
Yep. Fluoride, when it mixes with your saliva, creates way to re-strengthen and help remineralize your enamel, your tooth structure. It creates some crystals that help. It's called fluoroapatite, and that helps remineralize your enamel, and that's what provides the protection from bacteria and sugars that want to demineralize your enamel and what can lead to cavities.
I didn't realize that. So when you go buy your toothpaste, make sure you read it that it does have fluoride in it. Now, what about toothbrushes? Years and years ago, I used to always buy the most brittle toothbrush you can have. I thought that was really cleaning, but that's bad, isn't it?
They can be a little abrasive.
Yes. So the rule of thumb is you just want to get a soft, bristled toothbrush. If you have a lot of sensitivity, even like the extra soft ones, and then change it every 3 months.
Okay. That's for the manual toothbrush.
For the manual toothbrush.
What about the electric toothbrushes? Is there a big difference in brushing with a manual toothbrush or brushing with an electric toothbrush?
Yeah, there is. It's kind of like a power tool versus a manual tool when you're doing maybe hard labor or a job of yard work, It's a lot easier when you have the power tool. And the power toothbrush cleans more efficiently, faster, you're less likely to put too much pressure and stress on your gums, and they have just so much technology built into them now. A lot of them, the big ones, will tell you if you're pushing too hard on your teeth. They have timers built in, so you're brushing for those 2 minutes, and they can help break it into quadrants, so you hit each area of your mouth for the same amount of time and get consistency. Some of them even have apps that you can connect to your phone and track your brushing stats with. I mean,
Okay.
The technologies, and so there's just really great technology, but the really key to them is just that power action, and that can clean more efficiently than than most people can manually.
Okay, so it is better. Bottom line is, it's better to use an electric toothbrush than a manual toothbrush. What about water picking?
Kind of the same, along the same lines. I always say if you're not going to floss, then a water pick might be a good option. It also depends on what your general oral health is like and what the anatomy of your teeth are. And sometimes water picking does come in handy for certain situations, like under bridges and implants and things like that.
Yeah, I started water picking many years ago, and if I miss a day, it just doesn't seem right. So my ritual is at nighttime, that 2 minute or whatever it is, a minute and a half water pick, and then the 2 minute brushing. And by the time I'm done, my mouth just feels like it's as clean. It tingles.
It's like a power washer for your
right.
teeth.
It's exactly what it is. So you power wash it with the water pick, and then you brush it with the powered toothbrush, and you got a clean mouth. Some of the other items I wanted to mention, people who grind their teeth. Are those mouth guards that you can buy at the pharmacy, do those work well?
They're better than nothing for grinders, because if you do buy the over-the-counter ones, a lot of times you heat it up and you mold it to your teeth yourself at home. It's at least some sort of protection, a layer between your teeth, so the teeth aren't exerting that force on each other and you're wearing through that material instead. The fit of those is not going to be as precise, and just the durability long term won't be just as good as the ones that we can make in an office, where we take a custom scan of your mouth, and then we can build. We do a 3D model, and then we can build a night guard for you that's custom made for you, and the material lasts much longer, much more durable than the over-the-counter ones.
Okay. How do you know and we're just about out of time here, Phil, but how do you know if you need a mouth guard?
If you're waking up with a sore jaw muscles, sometimes headaches radiating up through your temples, if your partner hears you grinding at night, sometimes you get the elbow and they can tell you that you're grinding. And then if your dentist at your regular checkups, they might be able to spot it with signs of what we call parafunction, just patterns in the teeth and wear that show that things are breaking down.
Okay. If you got any questions at all, you can give these nice people a call at Columbia Healthy Smiles. Your telephone number is?
573-875-7071.
Okay, or on the web?
www.columbiahealthysmiles.com.
Got it. Thank you so much for coming by, and aloha to you.
Thank you.
Bye-bye.